also too, I was going to say that there are sometimes a lot of myths about, the hormone therapy and things like that. Again, if you pick the right thing for the patient, they'll be happy. They'll love you for it. And sometimes it does take a little bit of figuring out. Like I had some ladies, they had to go from, the pellets to the creams, or some people, the creams was not enough, so they wanted the pellets. But again, if you truly individualize their therapy, you can make about 98 to 99% of the women very happy.
Oh. And I think that's why it's so important to go to a practitioner that has really gone in on the science and just like explored all the different things, because like you said, and I've heard this before, that in medical school, menopause is just like a very
about 4 pages.
Wow.
I could go grab my book right now.
Wow. Yeah.
I still have it.
Yeah.
Welcome back to the Delulu Magic Podcast, where we dive deep into the unseen, what's behind your thoughts, your body, your energy, so that you can live your best life. I'm Paola.
And I'm Gabby. And today we're having a very special conversation for every woman who's wondered, why do I feel less like myself as you get older? We're peeling back the layers on menopause, brain fog, anxiety, hormones, and everything else related to that.
Yes. And today, to help us, we have Dr. Kimberly Evans, a board-certified OBGYN, cosmetic gynecologist, and the driving force behind Sugarland Medical Spa. She takes a full-body approach to health and things like sexual wellness, hormone balancing, and even bring in advanced therapies like the ExoMind so that people can renew and heal from the inside out. Dr. Evans, we are so excited to have you here. Thank you so much for joining us.
Thank you. I'm very blessed to be here today. This is an amazing experience between you and Gabby. I'm just so excited.
Yes.
Oh, yeah. Thank you. Same. Thank you for being here. Yeah. And I just wanted to say a little bit, like before we begin, for our audience and who's listening to us, that, this episode, we really try to create a space where we're just really trying to teach you and, give you a little bit of clarity and empower everybody, mostly women, right, that are going through this. And be very clear that, we're not diagnosing anybody. We're not, telling you, prescribing you anything, replacing doctors, nothing like that. This is just a conversation with somebody that we both, I highly admire you. I am a patient of a few years. So it's very exciting for me to be here. I want to learn more.
Thank you. Yes.
Well, especially as 2 women going through.
Yes.
3 women going through.
Like I said, our group.
Yeah, that's right. That's right.
So tell us a little bit about your journey, how you got started in this. I feel like you've taken a very different approach to treating women, and we'd love to hear about what started getting you driving down this path to say, hey, this is my mission, and I want to help women understand hormones in their bodies and even sexual wellness, things like that.
Yeah, absolutely. So I graduated in 2002, so I've been a doctor for quite some time. I think I'm becoming more of an old head now, as I would say. So literally, after practicing OBGYN for more than 20 years, I started to realize that in my space in Houston, the ladies I would take care of, eventually they would all complain of the exact same thing, no matter where we're from. And Houston is beautiful because it's so diverse. People from all over, people come here for their health care. And I started realizing that there is this unmet need amongst women for answers. And they would come talk to me. They would give consults to me. They would have their own gynecologist, and they would come see me because they're like, well, no one's giving me answers. I can't understand why I feel this way. So eventually I start doing lab tests. And I had this one particular beautiful patient I've been taking care of years. She had a testosterone level of 0, and she was in her 40s, right? So she wasn't quite in full-blown menopause, but I was like, what am I going to do with this? So most of the learning, unfortunately, that we as doctors get is all done in medical school. So literally after medical school, that pretty much closes the book on what we know about menopause and health-related things, the aging female, what we go through. And things like that. So everything after that, we actually really had to go after the information and teach ourselves how to do it. So literally I sought out, I started first with bioidentical hormone balancing, to figure out all about hormones. I had, kind of the basis of knowing, okay, these are the drugs that are out there that I can prescribe. But if you can only prescribe estrogen and progesterone, what are you going to do with a testosterone level of 0? So literally one of my patients was like, hey, yeah, you need to kind of find out about this and do more of this. So I started doing it, and it literally started changing one life at a time. And the patients would come back and tell me stories like, I've saved their marriage, or they wish they knew about it for the divorce. So if you're a man that just happens to be listening to this is hopefully educational for you too, because women, we go through stages. Like, you can be 16 and hormones are going crazy as a lady, and then as you get older, it happens again when you go through menopause, and it's not like some set number you just arrive. It's just like this, slowly induating thing that occurs through time, where you just feel like you lose a little bit more and more of yourself. So when I start realizing, I was like, wait a minute, there's something we can do now. There's solutions. And then literally I kind of built my practice around solving these problems. So literally, as I took care of the women, their men would come in and say, I cannot keep up. I need hormones too. So I started finding solutions for men. And then it came down to more sexual wellness and, everything from, weight loss and IV therapy and, the whole thing that comes with wellness. The Exomine was kind of like the final tip to the puzzle, because I literally had women that some of them, they were not hormonal candidates. Some of them could not relax to enjoy their partner during intercourse. So this is like why I find that, hey, this is why I needed the Exomind in our practice, and we were one of the first in Houston to actually bring it on.
Wow.
Yes, I'm sorry. That's a lot longer
No,
answer and explanation,
Thank
but
you.
just to give you the full shebang. Yeah.
Yes. No, I actually, I mean, and I've gone through the range, right? I am in my late 40s, and I listening to you, I'm still like, I remember that those years that there wasn't, what, and mine started pretty early, like things that I went through. So I'm always curious. I think you talked a little right now, you explained it to us, but it's like biologically, we don't realize what's happening as women. And I know that there's a lot more information right now, because I've seen it, I feel like, and I love to learn and research. But could you give us a little bit of what you see, since we're going to talk about menopause, perimenopause? Let's start there, because a lot of us, are always thinking, I used to think this because my mother had an early hysterectomy in the 80s, and so she had not a lot of information for me, but I always thought, hot flashes, that's it, you're done. Go to bed, basically, and get out of society. And so what happens when the perimenopause, like what others biologically, what's happening to the body?
Yes.
Inside and all that.
Absolutely. For lack of better words.
Yes.
Our ovaries are basically done. They're done producing eggs. They basically don't produce the hormones that used to sustain us. So as a result of not having those hormones in our body, for example, estrogen, we can now start having hot flashes during the daytime. We can have more wrinkly skin or loss of collagen in our face. In addition, we can have more munchies because we don't have that estrogen to kind of keep those down. So some women will have trouble, with maintaining their weight loss goals and things like that. But really the thing that I see a lot is actually, pain during intercourse, because again, there's not enough estrogen to sustain that vaginal moisture. Yes, and that's just one. And then we get to the testosterone thing, then we find that, some women, they would rather avoid intercourse. They don't want to interact with their husband. They become more frustrated, more easily frustrated. And I felt the same thing. I was just like, why am I mad when my order's just late? For example, food order's late. You know what I mean? But it had a lot to do with those hormones. So by replacing those hormones, you feel more like yourself. You kind of get your own self back. And that's what men say. They say, thank you, I have my wife back.
Oh.
Yeah.
And it's hard as a woman to go through that. And I think so many of us for a very long time, especially, and it's so good that you're doing something like this, because you feel alone. You feel like this is not normal. And one of the things I love about you is that you normalize speaking about these things, right? And that we do want, for a very long time, right? People have been married 20, 30 years. You still want a good sex life. You still want to, be able to enjoy things together.
Absolutely.
And you're giving them that back, to their relationship.
Yeah.
How often have you seen that women are misdiagnosed before they come to you? Is this something that they've been seeing doctors, and then finally, oh wow, okay, you finally told me what's going on?
Absolutely. Yeah, I've had someone as early as the age of 26 with a testosterone level of 0 and difficulty in her relationship. I've had women that are 28 and they could care less about life because their hormones are just so off. So literally what I would usually see is women would get their hormones checked, but if their doctors were unaware, like, what does this mean, then they wouldn't have the answers that they need. So a lot of doctors now, they're like, hey, I can, manage your high blood pressure and stuff like that, but you go to Dr. Evans for the rest of the stuff, which is fun because I get to be the fun doctor.
Yeah.
You know what I mean? Yeah. But it's very common.
Wow.
Yeah, it's very common.
Part that I do know, I was kind of talking to Paul a little bit. We talk a lot about mental health in our podcast because we've both been through things over the past few years. And I kind of mentioned to her that I know myself when things started happening that it was like, you're depressed.
Totally.
Something like go get on an antidepressant. Like I went through like a therapist, psychiatrist, my doctor, and then I actually, learned a lot from you, that I've watched a lot, learned, and realized that I was not going through those things. I didn't need to be on Lexapro. That doesn't take that people don't need to be on it, but my specific was that I found that somebody would listen and kind of go based on what I was saying instead of just the labs kind of work for me, but it was kind of like that resistance of like, no, like other I'm going to say it, other doctors would be like, it's this other thing. So it's just kind of putting, so I feel a lot of women have been had on top, like the misdiagnosed or just not realizing that it's all tied in to the same thing, all that's going on inside of our bodies.
Yeah.
Absolutely.
We're complex
Chemically.
creatures.
Yes. Yeah.
And in that mental wellness space, there's actually a lot of therapists now that are sending their patients to check their hormones too, because they find that it's actually augmenting what they're already doing. So it's huge.
Yeah. I waited a while to start hormone replacement therapy, which I kind of want you to dive a little bit into, if you, it's okay, Paula, like to tell us a little bit about the options for that. Because I was like, I don't think it's that. I probably need something else, right? Whether I do supplements or whatever. And I did find like, hey, progesterone does help with my anxiety. I could sleep a little better. A patch is going to make me not be feeling hot all day. And so,
Or as irritable.
Yes,
Yeah, I definitely felt that, where that resiliency, things that I could take on, right? And it's not a symptom that you even think about. So you're just like, I'm just overwhelmed. I'm just really tired. When in reality, it is your hormones.
Totally. So, yeah. It's like a little cycle for sure. So definitely, how we normally would balance someone's hormones. And mind you, every woman is different.
Yes.
So everyone may not be a candidate for hormones. They may need alternative therapy. And this is why, you need someone who's knowledgeable about all the solutions that are out there. So basically, to kind of get into that, what we would do is we would simply just do blood work, figure out where you're at, figure out what's missing, and then basically replace whatever's missing. And what's really cool is that we do it where we actually truly balance them. So every patient's different. I've had sisters on like different dosages because one of them, can be more sexually active than the other, for example. Or I've just had, single ladies where all they need is a little bit of estrogen and progesterone therapy. So, therapies can include, there's pills, there's patches that are there, there's injectables that are there, but it really just depends on, having that one-on-one conversation and then listening to the patient to see, well, what do they feel comfortable doing and where do they feel comfortable starting?
Yeah. Tell me a little bit about testosterone. So the very first time I've had my pellet with you, right? And I loved it, one, because it just lasts long. I am not a person to remember to take something or put something on every day. It's just not going to happen. So I absolutely love that about the pellets. But I feel like there's a big misconception, or among women, I remember telling my mom, you might need to get your testosterone checked. And she's like, I don't want to get all bulky. It's like always the first thing that I hear. I'm like, you're not going to, like, all of a sudden, you don't even work out that much. You're not going to, like, all of muscle all of a sudden. So is that something you hear commonly in your practice? And if you could kind of explain a little bit about testosterone and why it is needed for women.
Yes. And this is, of course, this is for my men that may be listening too. So testosterone is very important for women. It's the thing that gives us our gusto, our get up and go, our drive for the day. It definitely can lead us to have, a better libido, concentration, focus, and it calms us, which is really huge too. So the thing to know is that, and again, everyone's going to vary. so if there's someone from the Menopausal Society that's listening, I know that that those practices may be a little bit different than, what I'm accustomed to, but nonetheless, the goal is to replace what's missing without overdoing it. So with that in mind, in general, men, their strength of levels are about 10 times as high as women would be.
Okay.
But again, it's that little bit that we need that makes that huge difference on the impact in our life.
To me, it's made, and I feel like to you as well. Like it's the difference between me like laying in bed in the morning and being like, oh, I just, trying to get motivated to do certain things that used to be so much easier.
Yeah.
And I feel like it is one of those things that's just extremely helpful.
Oh, absolutely. I'm a pellet fan too, because, Lord knows we all got like a lot of stuff going on as women, and just in general, multitasking. And when you start to lose that and have brain fog, it's just, it can just be crushing sometimes.
Yeah.
You just really don't feel like yourself.
Yeah, not the drive. I mean, you described it perfectly. I'm listening to you. I'm like, that's exactly it. Like I say Paula brought me on to do the mid to late 30s, right? We started. And I remember there was there was so much going on. Like people were like, no, it's not good for you, all that. And I called it my weaning off. I was like, nope. Like I think I made it like 9 months, and I was like, get me where I need this pellet back on. And I remember telling her, and because at the time I was like, I have no I like to exercise, and I was like, I have no drive to get myself to do anything physically. Obviously sex drive was gone. And I was like, I'm not even 40. Like, what is happening? Like, somebody help me. And then I realized later, as the years have progressed, that I'm like, okay, this helps with my anxiety as well. Like, it clears up my brain fog. And we've had some friends also start using it that talk about now how they've seen those changes, right? And it's very quick when you're depleted. Like because she'll ask me if I say symptoms, and she's like, how are you doing on your levels? And I'm like, yeah, let me check that, because you're right. It could be, a reason why I'm feeling this way.
Yeah,
So.
totally. And also, too, I was going to say that there are sometimes a lot of myths about, the hormone therapy and things like that. Again, if you pick the right thing for the patient, they'll be happy. They'll love you for it. And sometimes it does take a little bit of figuring out. Like I had some ladies, they had to go from, the pellets to the creams, or some people, the creams was not enough, so they wanted the pellets. But again, if you truly individualize their therapy, you can make about 98 to 99% of the women very happy.
Oh.
And I think that's why it's so important to go to a practitioner that has really gone in on the science and just like explored all the different things, because like you said, and I've heard this before, that in medical school, menopause is just like a very
about 4 pages. I could go grab my book right now.
Wow. Yeah.
I still have it.
Yeah.
And then women are just suffering in silence, and I love that now they can speak up and understand it better and actually get treated. I feel like Gabby said earlier, we hear of symptoms of, from our moms, like the night sweats and the hot flashes. But what are some of the symptoms? Like maybe let's go through all the symptoms so that our listeners know, in case they're having some that maybe just that they don't think are symptoms, and they normalize that. What are some of the symptoms that they should be looking out for?
Yeah. I think the biggest thing is ladies, they just don't feel like themselves, or they're not sleeping at night. And when you don't sleep, it can lead to certainly overeating, just simply because your cortisol level is just kind of all off. And what happens, of course, you can have weight gain as related to that and things like that. So again, hot flashes, we already mentioned, the irritability, difficulty with partners, things just seem a lot harder in life, and those are the most common things. Yes. And I was going to make a point too of, a lot of people are worried about, certainly taking the therapy. However, there's a lot of misnomers when we think about that, and when we looked back at the data. There's a study that was done, the WHI study, and they showed that it was just one formulation of estrogen and progesterone that showed a slightly increased risk of breast cancer. But then when you look at topical formulations, things that go through the skin, like pellet therapy, injection therapy, they're a lot safer. And then they found out too that, of course, if you do it right and it's the right person to receive the therapy, then of course you can create this nice, safe environment for them to be treated. So you do want to make sure that, yes, you're keeping up to date with your health care, and, again, you're a good candidate for the therapy. But in general, again, as long as we do it the right way, then they'll be fine.
Yeah, the big ones are then obviously probably like you feel like maybe just it's not just regular insomnia, like you're not sleeping well, you're going to be hot. I think I'm going to speak of my experience that I had. Hormonal, I've been on testosterone for a long time, but I didn't start having actual perimenopause, I'll call it, more of a full-fledged. It started last year, and I was in denial for a while because I thought it was anxiety depression, all the things, right? And when it happened, I remember feeling the first time I could say it, I was like, I have a fever. I've got a fever, and my husband's like, you don't have and I was like, I think I'm sweating. I was not sweating, and I told her, and she laughed, but I was like, I could feel in the back of my neck so hot, and I just was like, please make it stop, just because I was like, I have a virus, and it's lasted at least a week, and I kept talking to myself like, it's too early. This is not for me. And I'm on the pellet. There's no way that I'm going through this. And finally I went with the practice I go to, and they're similar to you. They practice, they're very like the nurse practitioner. And I just told her, I think, she's like, how about we start with something low? I know you feel that you're not ready, but let's try. And I was like, okay. Oh, and within 48 hours of putting that patch on, the hot flashes were gone. No, and I've told you, this year I traveled, forgot my patch. It was like this, like 24 hours, and I was like back to like anxiety. I just was like angry, all this stuff, and I was like, nope, I will never, like, wherever I am, those patches are with me, and I'm okay with it. It took a lot of mental to that, finding that, reassurance and talking about it, because I remember even telling my husband those first few times, I was like, yeah, I'm gonna have to wear this patch, like, I mean, who cares, right? But I was like, I'm going through like menopause, and I'm gonna be hot all the time and be a furnace, and I'm gonna be not sleeping and going through all the things like you mentioned. And I also had a little bit of like joint stuff and a lot of inflammation, all that lovely stuff. And I was like, it is menopause. So I'm thankful like that you're educating, and I love to see, having conversations about it.
Same. I mean, I have a similar story. And at first, my kids were like, what is wrong with you? Because I would literally, so if you're a woman and you're walking through the house and all of a sudden you're taking off your shirt and you're like in a sports bra, and you're like, is no one else hot? Like, this is me walking around, and I'm like, guys, is no one else hot? And I'm like taking off my shirt, and like, they're like, what are you doing? I'm like, I'm hot. And then I was like, it's because I'm moving around and doing so much. That's probably why. And then when it really got bad, I remember sitting outside, and I told my husband, I was like, something is just off. And it was like those words. I was like, I can't tell you what is happening. I was like, but something is off. And I feel like when women feel like that, go get help. I just thought I was really stressed and overwhelmed. And I was like, I just can't handle things the way I used to. I felt like I used to be able to, like just carry the world. And that's not a great thing either, right? We should ask for help. Don't carry the world and be like, hey, this is normal. But it becomes something where you're not able to, as my husband says, you lose your like I give a shit hormone. I was like, I don't know what's happening, but something has to get figured out. And it's amazing that there are actual solutions, and we don't have to continue suffering.
And that suffering is huge. So women that I see, they may think that they're all alone, and then they just come in and they literally their fists are balled up because they're just so frustrated. And again, the littlest thing will just set them off. And when I start talking about it, like say, hey, there's some solutions, like we can check some labs and we can kind of fix some of this stuff for you. They just bust out crying, literally, because it's like they've been carrying this weight, of just everything, like the weight of the world, and there's no one that can help them. But there's stuff out there to help you. You just got to kind of go and ask the right questions.
Tell us a little bit about the ExoMind. So I know a few physicians are integrating, not as many are integrating something as advanced as the ExoMind. And so Gabby and I, again, are a lot into mental health, and we started meditate. We have tried we have gone in these last couple of years, and it really has helped. But obviously, sometimes you need something extra, right? You can only do so much on your own. So that's why, these therapies are so important. But what's a little bit about ExoMind, and why has it been so important in your practice? And what are you seeing, like, transforming patients?
Absolutely. So the ExoMind is basically this revolutionary device. It's I've used BTL equipment. We have the M-Scope Neo, the MSLA that helps with pelvic floor health. We have the MFem 360 that helps with feminine rejuvenation health. So when I found out that there's this device that they're coming out with in terms of mental wellness, I was kind of curious. I'm like, well, how can this be incorporated in my practice? But literally, because I see the women with the balled up fists that can't relax, that may not be ready for hormonal therapy, that are not sleeping, that feel like literally their life is kind of spiraling out of control. And these are also the women that they may not be ready, or they just don't want to lean on an antidepressant. So for me, I was like, well, we need solutions for those ladies too.
Yeah.
You know, because certainly the more people we can help, you know, the better we are as practitioners. So for me, it was just like a no-brainer for incorporating this. But it's basically a device. It uses electromagnetic waves to stimulate our neurons to release neurotransmitters.
Okay.
Neurotransmitters are certain chemicals in our brain, things like dopamine and serotonin, that then help us feel good. So pretty much they act very similar to antidepressants without the antidepressant side effects. So for me, antidepressants are wonderful under, you know, some circumstances. But for me, just because I do operate on, you know, most of my ladies, they want to help maintain their sexual function. The antidepressants have a negative side effect of kind of crushing that. So literally, rather than, you know, reverting to antidepressants, if I can help them release those neurotransmitters, they feel better, they're sleeping better, they're calmer, you know, they're doing better in life and feel like they can handle more and function more. Then I felt that, you know, hey, I've now done my job without picking up medicine. So essentially, I almost think I have this jet Jetson. You remember the remember the Jetson? So like long ago, where it's almost like you just step in a machine and like boom, you're fixed. Walk out, right? Yes.
I love it.
That's
So
here. That's
yeah,
this.
yeah, exactly. So it's, you know, I always kind of wanted, you know, the most cutting edge, the advanced stuff, the stuff that really works, that's research proven. So that was always important to me whenever I bring in, you know, something to help people. So that's really, you know, what this is all about. Just next level wellness, integrative wellness, longevity wellness, living better, living healthier without the need of just so much drugs. Yeah.
Oh, I'm so excited
Yeah.
because I'm going to be coming to do it with you, so I'm very excited because I don't want any more like I'm good with my hormones, but I don't want to have to take anything else. And so
Absolutely.
I know
That's what it's
I've
about.
seen she's spoken to me, and I'm so excited
Oh, yeah.
to come in.
And I think I also heard, which I feel like for all women, that it reduces, like, I think you called it food noise. Or, like
Yes.
the noise
Absolutely,
of,
yes.
so I get less munchies. I don't want to eat as much at night because
Yes.
it's always at night, and I don't know what other, you know, women have this. But it's all when I'm bored, and I'm like, okay, I just want to go peruse in the pantry. I'm like, I want to.
Absolutely, yes. So the technology has been around for years and years. It's really just the detailed people that just made it a little bit more sexy.
Okay.
And it made it so it doesn't hurt. So essentially it is cleared for things like depression, but they found out in other countries that it also helps calm the food noise and also help with obsessive compulsive disorders. So there's this whole nother thing, because we also do weight loss too, where we're actually using it to help calm that food noise, so that when they're at the end of their weight loss journey, then they can have something to then help with anxiety. Because you know, like some people, they get anxious, because I was one of them. I will grab chocolate in a heartbeat. Yeah. So definitely, if this can help them, then it's, you know, it's just overall just better health for you.
This sounds like magic. I want it. I'm
Sure. Yeah.
I'm like,
Just
I
magic,
need
yeah.
this in my life. And so the ruminating, so things like, I never used to have ruminating thoughts in my 20s or 30s, right? Where you literally start almost annoying yourself. I'm like, I don't want to be mad about this. And it's not even that big of a deal, but I keep coming back to it and spiraling. So is that something it helps with as well?
Yes.
She's like,
Needed.
yes.
Also,
Needed.
does it help? I've heard this, so I'm like, I'm just asking y'all a question.
my things,
for
my
selfish
own-
for me. ADHD. So I got diagnosed as an adult as ADHD, with ADHD, and I didn't realize this, and I think there was some shame around it as well. But I've heard a little bit that this can possibly help with, I guess, the executive functioning of, or how is that processed? Is that?
Absolutely, yes. It helps with those decision-making things. Like literally. So granted, yes, there's definitely more studies that need to be done to help, you know, prove some of this stuff. But it's like, for the most part, like the backbones are there in terms of, you know, where this can take us. And literally what they may hopefully start doing too is that by activating certain regions of the brain, there's more stuff that they can do to help people. So again, I've always thought that they're on like the cutting edge of figuring out, you know, what do people need, and, you know, definitely the safest way to deliver the therapy to them. So literally it's just like a matter of time. So again, I couldn't wait. I'm like, yes, I'm on board. It sounds great. Let's do it.
Yeah.
You know, and then what else can we do next?
Yes.
Yeah.
And I'm very excited. Like for the diagnosis you're giving to other people,
Yeah.
we will partake.
Absolutely. And it doesn't hurt. Most people, when they get done with the therapy, they just feel like they're just so relaxed. You know what I mean? Yeah,
Yeah.
it's just feels so relaxed,
Quiet
and then
the
they,
brain.
they sleep better that night. You know what I mean?
Oh, how nice.
Yeah.
I know.
Quiet the
And
brain.
this
We're
is
all
like
excited.
a perfect thing for women that are juggling so much. I know men juggle a lot too, but you know, we're juggling kids, careers, trying to look good, trying, you know, just cook everything. So I feel like it's something that's so needed. I can't wait
Absolutely, I completely
try it.
agree. Yes.
I do. I have one last question. If you could dispel one myth or a lie that we've heard about menopause, you know, and aging, the thing that causes so much silent suffering, what would that be?
Absolutely. I would say that for us ladies that are told it's all in our head, that's like the biggest myth. You know what I mean? Or people that have made us feel like it's all in our head. And I hear that all the time because like literally when I review labs with patients and they're like, that explains where my sex drive went. Or, you know, that explains why I'm hot all the time or where I'm irritable because that number's like in the toilet. Then I give it back to them and they're like, well, heck, I wish I would have known this sooner.
Yeah.
Yeah,
Yeah.
exactly.
I guess
Yeah,
it's like your sanity almost. Like you're just
absolutely.
like, oh, okay.
Yeah.
Well, you know, because you are
Yeah.
made to feel
Yeah,
a
yeah,
lot
yeah,
of-
yeah.
Yeah,
the
like
society with you, like, you know, just grit and bear it.
no, like
Go
there's
through.
something
Yes.
wrong with the when
Yeah.
when it's such a normal thing, and there are things that we can do for it.
Yeah.
Absolutely. Yeah. It's a great question though.
Absolutely.
But yeah, I think too it's again it's letting go of that weight that we feel. Like it's all on us. There's no answers. No one can help us. You know what I mean? It's again you just have to try to look and say, hey, there's other doctors that are specializing in this. Yeah.
And I think there's some shame to it, right? And there shouldn't be. But do you feel like a lot of your patients, do they actually discuss it with their husbands, or is this something that even me, that my husband, we were both in the field where we would have these different devices and talk about hormones, and even still, when it came to it, first I couldn't even figure. I was in denial that I was in perimenopause, and two, there was like some shame to it. Do you feel like a lot of women feel that, or do they
Absolutely.
usually discuss it with their spouses?
It's kind of split. It kind of just depends. Certainly, aside from that, it's all in our head, but certainly it does take a nice, understanding significant other to know that, hey, there really is something wrong. But the cool thing is that when we fix it for them, their spouse will be the first ones who are like, hey, I think your hormones are low. You need to go back.
Now I know all about
Yeah.
them.
Yeah.
Yeah, literally. But it is, and it's sad to see some of the shame and again the pressures that we women will carry. But I see it a lot. This is why they'll break down crying when they're like, oh, you understand me, you hear me. This makes perfect sense.
Yeah.
Yeah,
And so you treat the women, but
Yep.
you also treat men.
Absolutely.
Because
Yep.
they probably come running after. They're like,
yep, trying to
Me
keep
too.
up. Yep, exactly.
Yeah.
And you know, it's universal. You know, I think the baseline for hormones, whether it's menopause for women or menopause for men, you know, when it comes down to weight loss, living better cardiovascular health, you know, better muscle tone, better performance at work. I mean, you know, the list goes on and on. A lot of it has to do with hormones. So people, they may start a weight loss diet and then it's not successful. It's because, you know, like their thyroid wasn't balanced, you know?
Yeah.
yeah. This
For
is the first
example.
time I heard of menopause.
No,
Yeah.
yeah.
I have
I
actually never heard that
I
word.
have. I know. Yeah. They go through their own
Honest
stuff
women.
too.
They sure do. They don't want to admit it sometimes.
Yeah.
They're
Yeah.
like, well, it's
But
not
they-
working, but it's, you know, it's okay. Like, no.
And they
There's
need
something we can do about that.
Yes.
We could have a whole episode about
A
that.
whole
We're
episode.
bringing
For our
everybody
special
back to
guest.
young. Yes.
Very good.
If there was one thing that you could tell your 18-year-old self, what would that be?
Oh, that's a great question. I probably would just say it's okay. So through life, certainly as a woman, as an African American woman, you know, I had to go through some hard stuff, and I don't want to get teary-eyed, so don't share this. But yeah, I've seen women be treated meanly, and it's scary for me right now because of all the stuff that's going on that I necessarily won't get into, but it's scary for me to see, well, where is this going to end up at with the way that we're going? Are we going to have, you know, things taken away from us? Are we going to, you know what I mean? It's very scary. Even now I'm telling women, you know, like, hey, you know, try to get your birth control, you know, in place, or, you know, definitely fight for what you think is right. And, you know, don't take that answer as the end all be all when it comes to even, you know, some providers, like, it's okay to get a second and third opinion. So, you know, throughout this journey, you know, and some of the listeners probably have gone through this too, where they believe in their self. This is what they believe that their purpose is.
Mm-hmm.
Stop what you're saying. Sorry.
This is good.
I know.
People need to
Thank
do it.
you.
They do.
Yeah.
They
You know
do.
why? Because they see you,
Yeah.
profession,
Mm-hmm.
Yeah.
to know
Yeah.
that what you've been through is
Okay.
important.
Mm-hmm.
Is there Kleenex over there?
Yeah.
Sometimes we try to. I think sometimes we try to keep it so
Yes.
professional, you know,
Yes.
for what people
Well,
see.
this is-
But
yeah.
For sure. I'm so sorry.
That was
I
a
do-
whole-
I
question
honestly
is
think-
all Paula's fault.
I know.
But it's a great question to ask.
Okay. All right. So I don't have anything to write. Okay.
No, you look
Okay.
great.
Yeah,
You
yeah,
look great.
yes.
Perfect. Okay. So, okay. I'm ready. Okay. So, back to the purpose. So, I think when you go through life and you realize that God has set out this purpose. So, my purpose was never to just deliver babies my entire life. My purpose was to figure out what's needed for people and then help solve those problems. So, this is why I had to include, the men too when I was fixing the women, because they were a huge part of what makes women happy. So of course, when I go through life and then you get told, no, you're doing it wrong, or we're not going to support you for what you're doing, or, I remember even in med school where I was a resident and they were taking care of a woman who looked pretty much just like me. She was being operated on and they were calling her, overweight, and they were making comments about her. So thanks to God for having situations like that to give me the empathy to listen to
Yes.
people.
Yes. Absolutely. Thank
absolutely.
you so much for sharing that.
That's beautiful.
No, it is.
You.
And,
Thank
and,
you so much. We are so
Yes,
grateful.
yeah.
'Cause
and you're right. I think in seeing that, it, I think it sparks something that you're like, I'm going to treat my
Absolutely.
patients differently. And that's why I feel like they come here, because you have that empathy, because you can understand them. And, we want as women, not just a provider that's going to be like, great, let's check these, hormones, but somebody that understands us and makes us feel a little less crazy and makes us feel like,
Absolutely.
accepting no matter how we look, how we think, anything.
Yep,
So
totally.
we appreciate you so much.
Oh, thank you. Thank you.
Yes.
God bless you. Yes, it's,
Thank you.
most things were put through life in order to have that higher purpose of understanding.
Yes.
Yep, do
Yes.
better.
We don't realize it at the moment. but-
Yes.
I know, right? Exactly. We're
moment,
sitting there
we're like,
bawling, crying in the
what?
moment. Yeah,
Like, that
but
was
it's like,
not what I
okay, there's a reason for this.
Always.
There's a reason
Yes,
for this.
there's and finding that.
Thank you so
thank
much
you.
for being here with us on
problem.
Delulu Magic
Yes.
today. This has been
Thank you.
phenomenal, and we'd love to, absolutely have you back so we can talk more a little bit about
We have a lot
sexual
of
wellness,
topics.
the O shots, all
we
the
love
things.
Oh,
everything
for
here.
sure, for sure. Absolutely.
We're both
Absolutely.
very excited.
Yep.
Yes.
Yeah.
Thank you so much for joining us. Don't forget to subscribe and like.
Yeah, and we'll see you next time.
Bye.
Bye.
Thank you.
Thank you.